Hello, welcome to the Health Records PowerPoint presentation. Within this presentation, I will give you an overview of the health records that will be needed to be uploaded to Castle Branch. As was discussed in the Castle Branch presentation and included in your packet, you must first go to mycv.castlebranch.com. Enter the package code UE34IM. That will be signing up for the Medical Document Manager, aka the Immunization Tracker. After signing up, a to-do list will be created on your Castle Branch account. What you see here is a list of all the requirements that you will need to upload to Castle Branch. You see that most of them are health records. However, there are also a few forms that you will need to download, read, sign, and re-upload to Castle Branch. This next shot is what it will look like for you when you sign into your Castle Branch account and click on your to-do list. You will see that each requirement is listed separately and has a box to click Upload File. As you start accumulating documentation to upload to Castle Branch, consider what type of documentation you have. Here's an example of a document that would be considered not official, something that your clinical site may reject, and we would need to ask you for another documentation. And then on the right side is something that would be considered official. To be safe, when you upload a documentation to Castle Branch, try to have one of these three things. You can see that this is printed on letterhead. It has a signature from the healthcare provider, and also any healthcare provider should have a stamp. You can even bring in your old existing documentation and have them stamp the document, and that would make it official. Before we start going through the individual records, I want to first mention that if you're not sure how to get started, I strongly recommend you check the Wisconsin Immunization Registry. The web address is listed here on the left side of the screen. Any records listed on the WIR, you can use a print off or screenshot and upload it to Castle Branch. Just be sure it either shows the web address or notates WIR somewhere on the form. What you see here on the right side is a copy of the checklist that was included in the packet emailed to you. You can use this checklist, however you do not need to. You can use any documentation given to you from your healthcare provider, whether it is paper copies they gave you in person or a print off or screenshot from their website. That being said, some of you may be able to use this checklist, have it filled out by your healthcare provider, and upload this same document for each item listed. Others may need to combine or piece together multiple documents to complete these requirements. You can use the same document for all the requirements, uploading the same document to each one, or you may need to upload multiple documents to fulfill one requirement. Both scenarios are normal and okay. On the next slides, I will go through this list and give you a brief overview of how to complete each requirement. Please feel free to follow along on the checklist from your packet. The first requirement you need to complete on Castle Branch is the TB test, tuberculosis. There are three options for completing the TB requirement. The first and most common and cheapest is to get the skin test. If using the skin test, you must upload 2 tests from within the last year. They can either be 2 annuals, one you received previously for a job, volunteer work, or something else, and then you must get another test dated after June 2nd. If you have not had a previous TB test or it has been more than a year, you will need to get a 2-step TB skin test, which is 2 tests 1 to 3 weeks apart. That means you are visiting your healthcare provider a total of 4 times, once to get it placed, 2 days later to get it read, and then the same process again 1 to 3 weeks later. The first of your 2-step can be before June 2nd, however the second must be after that date. The reason your most recent TB test must be after June 2nd is because the clinical sites require it within 90 days of starting at the facility. Some of you may end up getting a blood test, most commonly the quantiferin gold. If you get a blood test, you only need 1. However, make sure it is again after that date of June 2nd. You can also combine the two. If you had a previous blood test from within the last year, you can get 1 skin test and upload the 2 together. Again, bottom line, make sure your most recent test is after June 2nd of 2020. If using the blood test, you need to upload the actual lab report to Castle Branch showing the reading and interpretation. Finally, some may have needed to get a chest x-ray at some point for any variety of reasons. If you have a chest x-ray report saying your lungs are clear of infection, you can use that in place of the typical TB test. Again, like the blood test, you need to upload the actual lab report. Reach out to me if you have unique circumstances and need any help in figuring this out. The next three are what is known as the two MMRs, mumps, rubiola, and rubella. They are all combined into one vaccine. You have two options to complete the MMRs. You must either upload documentation of having received your two MMRs, two vaccines at least 1 month apart, or you can get a blood test to check your immunity level to all three. Again, like the TB test, if you get the blood test, make sure you upload the actual lab report for all three diseases. Something to take note of is that I said the two shots must be at least 1 month apart. I strongly encourage that you have this all figured out at least a month prior to the deadline. If you find out you are not immune to something and end up needing to get the two shots, which must be at least 1 month apart, that means you're going to miss the deadline, which means you cannot start the major in fall. Don't let that happen to you. The next requirement is varicella, aka chickenpox. Like the MMRs, you must upload either documentation of two vaccines or results of a blood test showing you are immune to varicella. Be forewarned, every semester we have students that assume they are immune to chickenpox because they had it in their past. They had the disease in their past. However, when they get their blood test results, it turns out they are not immune after all. That means they need to get the shots, which must be at least 26 days apart. So again, like the MMRs and other requirements, please have this all figured out at least 1 month before the deadline. The next health requirement is hepatitis B. For Hep B, you notice there are 3 lines on the checklist. The first 2 shots must be at least 1 month apart again, and the third is 6 months later. If you have never received the immunizations and are getting them for the first time, it is okay to have only the first 2 by the deadline, since there is not time to get all 3. Upload your first 2 and Castle Branch will create an additional item for you to upload the third at the appropriate time. Again, like the other requirements, there is an option to get a blood test to check your immunity level. If you get the blood test and it turns out you are immune to Hep B, upload the positive lab report to Castle Branch. The next health requirement is the Tdap, tetanus, diphtheria, and pertussis. You must have received the adult Tdap at some point. The Tdap is good for 10 years, and then you must have at least the TD booster every 10 years after that. Most of you will have had this within the last 10 years. However, it is likely that you will need to get a booster while in the program. All these requirements must be kept current while in the program and cannot expire during the upcoming semester. Just something to keep in mind. The next requirement is the physical. As with the TB test, your most recent physical must be within 90 days of starting clinical. You can use the form provided on Castle Branch. However, you do not need to. Finally, the flu shot. It is not required to start for fall semester. However, all students and faculty must upload documentation of their flu shot before November 1st to continue attending clinical. If you do not get your flu shot before November 1st, you will not be able to attend clinical until you have it uploaded to Castle Branch. It is required to start spring semester though. Again, you can use the form provided on Castle Branch, however, do not need to. This is a lot of information and can feel daunting if you are not sure how to attain all these records. Feel free to contact me if you have questions or are having any difficulty. I'm here to help you figure this out. Also, I encourage you to attend one of the scheduled Q&A sessions where we will be able to provide you with clarification to any of your questions.